Good morning again, everybody. We waited a couple of minutes, and so I think it's fair to start, kick things off, as everybody's very busy and have things to do. Thank you to everyone for attending today's public health officials media briefing. It's been busy times here in the Yellowknife area, so appreciate that everybody who's able to make it out. With us today, we have Dr. Kandola, NWT's Chief Public Health Officer, as well as Dr. Anne-Marie Pegg, NWT's Medical Director. They'll be here to give an update on the pandemic response. The format for this is the same as normal. Dr. Kandola will provide some remarks, be followed with Dr. Pegg providing some remarks. And after that, we'll get to the question and answer session with the media. Each member of the media will get to ask one question and one follow-up question. We ask that you respect that, so all media who are here are able to ask their questions in the time allotment that we have. Any follow-up questions that you have, you can contact me at darren_p_campbell@gov.nt.ca. I think everybody's, I'd already reminded everybody to, other than the people who are speaking or when they're asking questions, to please put yourselves on mute and also turn off your video cameras if you're participating via Teams video conference, just so we don't have any outside chatter while we're doing this media briefing. And with that, I will turn things over to Dr. Kandola to provide her remarks. Thank you.
Good morning. I'd like to start by updating everyone on the current COVID-19 situation and some positive developments in our vaccination program. And then I want to talk about what we can all do to keep ourselves, our loved ones, and our communities safe. Since the onset of the pandemic, we have done our best to protect the Northwest Territories. We have all contributed to the layers of protection. Our travel restrictions have been difficult for many, but they have reduced the risk of bringing COVID-19 into the territory. Our restrictions on gatherings have changed the way we celebrate our lives, but these changes have prevented transmission in case someone became sick with COVID-19 in the Northwest Territories. We have worn masks to stop respiratory droplets at their source, and we have washed our hands in case some droplets got away. The health authorities have introduced PCR and other rapid point-of-care testing into NWT to diagnose people quickly. The public health teams have interviewed every person who developed COVID-19 in the Northwest Territories, and sometimes those who developed COVID outside of the Northwest Territories. And we have notified thousands of people that they are contacts and helped them isolate safely. Multiple government departments have worked together with support from the federal government and the National Microbiology Laboratory in Winnipeg to set up wastewater testing in the Northwest Territories. Representatives of the National Microbiology Laboratory have flown up to Yellowknife to teach us how to test wastewater in our own backyards. Big industry and small businesses alike have committed to work with my office to try our best to protect our workplaces from COVID-19. And the Public Health Agency of Canada did prioritize the Northern Territories to receive COVID-19 vaccines. Collectively, we have tried our best, and for many months of this pandemic, it worked. We've kept businesses and workplaces open as much as we could. We've kept our schools open for long periods. We've maintained recreation for all, especially children and youth. These layers of protection, however, are not perfect. The risk of importation of COVID-19 from Canada has never been as high as it has been in these last few weeks. The new variants of this virus are highly transmissible. Once we have COVID-19, the virus finds ways to infect those around us even before we have symptoms. It transmits as we take care of each other, play sports with each other, hug each other, it is nobody's fault. We all do the best that we can. And in some situations, we can all do a little more, but it is nobody's fault that they acquired COVID-19. Right now, Yellowknife is experiencing what many other Canadian cities and communities have experienced during this pandemic, and we must rise to this challenge. As of the morning of May 6th, there are 47 people with confirmed COVID infections and 3 people with presumptive infections. About 90% of these 50 infections are in children and youth. The remainder of the infections are in adult household contacts. There have been numerous public exposures and over 1,000 people identified as contacts. Please continue to review public exposures and follow the advice we are providing. Because of the risk of transmission in households has high, contacts and their household members must all isolate. In some situations, essential workers receive permission to work with extra precautions in place. Right now, many people in Yellowknife and even some people in other NWT communities are isolating, and isolating is difficult. Because COVID-19 spreads in households easily, try your best to follow the advice for safely isolating at home. This includes perhaps one parent instead of 2 that can isolate with a COVID positive child. Perhaps the person who is at high risk for severe COVID can live somewhere else if there is a contact to COVID in the house. Ideally, a person with COVID or a contact should stay in a room of their own with access to a private bathroom and bedroom. Try to ensure that any spaces that families must share are well ventilated, for example, by keeping windows open. Sometimes it might be necessary to even hang a sheet from the ceiling to create a barrier to protect families further. People with COVID-19 should wear medical masks while indoors. The household members could wear medical masks too, or non-medical masks if that is all that they have available. The NWT can try to help families of cases or contacts isolate safely at isolation hotels. Please contact your public health nurse if you think you or someone in your home should stay at an isolation hotel. Most of all, families must stay safe. We can all help those isolating by making sure our neighbors or families or friends have the things they need. We can help with groceries, or we can walk a friend's dog. All the infections from the current school outbreak are in students, close contacts of students, or household members. We have not identified new infections emerging in people not connected to the current school outbreak. My assessment is that we're not experiencing community transmission. We are, however, on the brink of community transmission, and we are monitoring the situation closely. What else can we do to keep ourselves safe and protect NWT? Vaccines are the best way to protect NWT. Canada and Northwest Territories are privileged to have an abundant supply of vaccines. COVID vaccines in Northwest Territories can prevent about 95% of COVID infections. And in those that do develop infections after being fully vaccinated, the illness is milder. There is emergent evidence which confirms that COVID-19 vaccines prevent transmission of the virus, and hundreds of millions of people have received the messenger RNA vaccines across the globe, and they are very safe. The NWT is monitoring for adverse events from immunization. We do know the mRNA vaccine can make people feel feverish and sick for about a day or 2 and can cause local pain or swollen lymph nodes. But in the Northwest Territories and in the hundreds of millions of doses administered, there's no safety signal of serious adverse events. Health Canada has also approved the Pfizer vaccine for children 12 to 17, and as of yesterday, Northwest Territory has already started immunizing this age group. This is an important milestone in the vaccine program. Just 2 days after securing doses of the Pfizer-BioNTech vaccine and 1 day after Health Canada approved it, it's used for those 12 and up, we were able to get needles into the arms of our Yellowknife youth. And to my knowledge, We are the first jurisdiction in Canada and possibly the world to begin vaccinating healthy 12 to 15-year-olds with the Pfizer BioNTech vaccine. My son Jordan was one of those youth lucky enough to get vaccinated yesterday. And I am both relieved and proud that our teens were able to mobilize so quickly and start vaccinating our young people, given the clusters of cases involved in this age group here in Yellowknife. And I know many people are anxious to get their children vaccinated, especially those who may be currently in isolation. Please know your child's turn will come. I look forward to releasing more details next week about specific vaccine opportunities for those in isolation, as well as our plans to deliver this Pfizer vaccine to other NWT communities. And I do want to remind anyone in isolation that if they have no symptoms and wish to be vaccinated, they can email cpho@gov.nt.ca and they can request written permission to do so. Right now, written permission is required to ensure proper coordination and personal protective equipment for the safety of everyone involved. I also want to remind adults that if you have not been vaccinated, now is the time. It can save your life or the life of someone around you. Besides getting vaccinated, there are other simple things we can do that we know work to stop the spread of COVID-19. Stay home and arrange for testing if you have symptoms of COVID-19. Continue to follow all the advice to reduce exposure. Wear masks when indoors in public places. That's now mandatory in Yellowknife and Bitrico. Keep your gatherings small. Use the outdoors, the sun and the wind and the air protect against transmission of COVID-19. Wash your hands and follow healthy respiratory practices. Most of all, be kind, do the best you can, and we will get through this. There are a number of new public exposure notifications coming out. As we saw yesterday, in some cases, our office is dropping certain locations now that we have better evidence to show a reduced risk. So this is good news. And this is how we make calculated risk assessments. Based on testing results, we have been able to calculate probability rates of exposure at some locations. And these results show low enough probability that isolation or other requirements in relation to these locations is no longer necessary. We will be providing regular updates for the next week or two. And people should continue to be aware of these exposures and follow the directions that are outlined on the GNWT COVID-19 Public Exposure Notifications webpage. I know it can be shocking when it happens to you, when you are notified and asked to divulge information. We continue to interview as many people as we can to determine all the details so that you know where exposure locations are situated. Again, as I've stated before, we will never divulge any of your personal information to anyone. And this is why it's so important that we understand why privacy matters. People need to be able to trust that what we tell is private. Knowing what to do all of a sudden in these situations is hard when it becomes real. And you can find answers by going to the GNWT COVID website or calling Protect NWT 811. Just for clarity, I'd like to repeat testing directions so that everyone is up to date. This is in order to make sure testing capacity does not get overwhelmed. So anyone who's symptomatic will be tested. However, only those considered contacts of COVID-19 cases will be tested at this time. If you're in the same household as a contact and are symptomatic, you are at higher risk, so please call public health or your health center to arrange testing. Finally, we have so many people and organizations that are coming together to find innovative solutions to help during this challenging time. Your innovative ways of coming up with these solutions are part of what will get us through the coming weeks. So everyone has a role to play. Yours may be staying home or following the healthy habits we need to follow. It might be putting together groceries for touchless delivery. It might be making phone calls for people who need to talk. It might be thinking very carefully about how your words on social media may affect others. On the radio the other day, I heard kids talk about how great it is to be part of the solution. Now that they are able to get the Pfizer vaccine, it opens up many opportunities. This warms my heart, and I look forward to seeing more and more young people getting vaccinated in the coming weeks. So be part of the solution too. Thank you.
Thank you, Dr. Kandola, for those remarks. Now I'll turn it over to Dr. Anne-Marie Pegg to provide a few remarks as well.
Thank you. Morning, everyone. There are three main points that I'd like to bring forward to everyone's attention today. The first one pertains to testing. If you've been advised to isolate, follow the guidance and help us keep this under control. We can work together. We can stop the spread of COVID. If you are symptomatic or you've been identified in an exposure notice that requires testing, then you need to get tested. If you don't have symptoms and you haven't been included in an exposure notice that advises testing, then you don't need to be tested right now. Keep monitoring for symptoms though, and if you develop any, please arrange a test. Our lab is working full out at the moment. Between April 29th and May 5th, the Stanton lab processed approximately 1,300 tests. But our goal remains the prioritization of testing for those who are most likely to be at risk of having COVID-19. This is critical in reducing further spread. This may mean that if you book a test and you don't fit into one of the groups, you may be delayed or deferred. It also means that currently we aren't testing every member of households that are isolating as a result of the MJ outbreak. If you're in direct contact of a confirmed positive, public health will contact you to book an appointment. They have specific appointments reserved for this to ensure that testing can be done in a timely manner. If you become symptomatic and are in a household with a direct contact, you should book an appointment as soon as possible. I really want to stress the great work that the laboratory has done and the great response from our community in the call out for testing in response to this outbreak. It's excellent to see. My next 2 points are about vaccination. If you are 18 years of age or older, we have still plenty of Moderna vaccine, and we really still want people to get it. In Yellowknife, Inuvik, Fort Smith, and Hay River, you can call your public health unit or health center, and they will let you know how to get an appointment. In Yellowknife, you can book online. All of the details are at nthssa.ca/COVID-vaccine. Betchico had a great turnout yesterday for a Moderna vaccination clinic and will run another clinic for residents over the age of 18 on Monday from 1 until 5. You can call the health center to be put on a list so they know how much vaccine to give. We gave over 100 doses at the pop-up clinic on Thursday. Everywhere else in the territory, you can call your health center and ask to be put on a list for the next possible opportunity for a vaccine. Or if you're passing through one of the hub communities, you can arrange for a vaccination to be done there. For those aged 12 to 17, if that's you or you're a parent of someone in that age group, we are working to expand access to the Pfizer vaccine and will announce another clinic in Yellowknife that will take place next Wednesday. We haven't opened bookings yet, but we will provide in advance a lot of notification before we do, and we'll make sure that this is clear and shared broadly. If you do not live in Yellowknife or are not able to get an appointment, please don't worry. We will announce further opportunities as we receive more vaccine, which is scheduled to happen later this month. Betchico will have a clinic for 12 to 17-year-olds on Tuesday, May 11th from 10 until 4. Again, you can call the health center for more information about that clinic. And we will announce schedules for all communities later this month once we're able to build our plan for going back on our vaccine tour. Keep your ears and eyes open. We will make sure as well that this information is shared broadly so that everyone knows. One last thing that's really important for everyone to know. If you're on the fence about the vaccine, considering getting it, or have some questions, please reach out to your healthcare provider. We're happy to have these discussions and help share information that is reliable and evidence-based. This is the moment to continue to be supportive and to be caring to each other. It's a difficult moment for our affected communities. Be proactive. Focus on doing what is within your control to limit the spread and to protect yourself, your family, and your community. Wear your mask, limit your contacts, and monitor for symptoms. Thank you.
Thank you, Dr. Peg, for those remarks. Now we've reached the Q&A portion of the media briefing, and first off, I'll ask Sarah Sibley with Cabin Radio. Do you have a question for either Dr. Peg or Dr. Kandola?
Yes, I do. Thank you all for taking some time to chat with us today. My first question is the NJ McPherson outbreak connected to the April 5 case cluster? And if not, where did it come from? If you're still investigating it, can you explain why it's taking so long to identify where the case came from?
So what we do know based on our reverse contact tracing on the cases that we have resulting from the NJ McPherson outbreak, we do have reason to believe that there was exposure to a case that was during their infectious period, and we're investigating that further, but that's all we can provide. Thank you.
And just a follow-up to that, are all the cases connected to the MJ McPherson physical site, or have there been any cases so far that have been connected to an exposure site?
So we have 47 confirmed cases from the NJ McPherson school outbreak, and we have 3 probable cases awaiting testing confirmation. So what we do know is that pretty much all of them are linked to NJ McPherson, either for people who attended NJ McPherson during that previous week or their household contacts. In terms of the exposure sites notification, we have labeled them either as people to either isolate or to self-monitor. And to date, we haven't had any transmission in those sites, but we know that we are entering that critical time period, especially around between day 5 and 7 of from the exposure notification. And so we are asking people that if they do develop symptoms to call public health. But to date, there hasn't been any transmission on those areas that we have marked as exposure notifications, but we're monitoring and waiting. Everyone who is identified as contact still has to go complete 14 days from that exposure.
Thank you, Dr. Kandola, for that. Marie Soleil with Laquillon on Radio Taiga. Do you have a question for either Dr. Peg or Dr. Kandola?
Yes, I will start with questions for Dr. Peg, well, I believe, or maybe Kandola. Why do you ask contacts to self-isolate for complete 14 days, even if they had a negative PCR test 4 days or more after their potential contact with a positive case?
I'll start, and if Dr. Kandola has anything to add, she can certainly do so. The reason for that is because the incubation period of the illness can last 14 days. And despite the fact that a PCR test can be negative, there is a chance that the viral load, so the level of infection in the person who is being tested, is still too low to actually be picked up by the test. It's a very sensitive test, but particularly for people who are not showing symptoms, the viral load can result in a test that doesn't have enough for it to turn positive yet. And therefore, we ask them to continue the isolation period and to get retested if they do develop any symptoms.
And just to add to that is I've had parents contacting me say with these negative results, with the assurance that they feel that they have a negative result, they don't need to isolate anymore. And what we have to stress again, as Dr. Peg has already stated, it's 14 full days after the exposure, and people have been known to become positive up until the 14th day, and a very small minority past 14 days, but 14 days is the universal standard of a cutoff for the incubation period of COVID-19.
Marie Soleil, do you have a follow-up question for either Dr. Peg or Dr. Kandola?
Yeah, I have. In a May 4th public service announcement, it was written that if someone is a contact of a person with COVID-19, the contact must stay within their accommodation or their property. And then it was specified that contacts may go outside for fresh air as long as they have their own outside space and remain on their property. My question is, what scientific evidence support forcing a contact to remain on their property?
So we've had transmission occur when people who potentially have COVID and not aware, they can transmit it to people who are susceptible. And because we're dealing with people who've had very close contact to cases of COVID, and we are trying to contain this outbreak as quickly as possible so that kids can go back to school, it is really important that people follow the public health orders. This is extremely different from when we're talking about people traveling into NWT, where we have the 14-day public health order and travel restriction, self-isolation. We're talking about households and close contacts of known COVID positive cases. And we're talking about a highly transmissible COVID-19 virus, because we have had confirmation that the cases that we're seeing in NJ is attributed to the UK variant, or the B117.
Thank you, Dr. Kandola, for that. Natalie with Yellowknife News North, you have a question for either Dr. Peg or Dr. Kandola?
Yes, thanks so much to everyone for taking our questions this morning. I don't know if you guys would have these numbers offhand, but I was just wondering, since the health emergency began, if you happen to know how many people have broken isolation rules, and from those, how many have been ticketed and how many have been issued warnings, pardon me.
Natalie, that's actually, yeah, that wouldn't be information that Dr. Kandola or Dr. Peg would have at their fingertips. So we do have consolidated stats that put out on a weekly basis that does have some of that information, but I can follow up with you on that after the call, if that's okay.
Okay, great, thank you.
And you can email me about that.
Okay,
but,
perfect.
I don't know if you have a follow-up question to that for either Dr. Peg or Dr. Kandola.
I was wondering, I see that the Yukon is changing their isolation measures so that those who are fully vaccinated would not have to isolate. I'm wondering if Dr. Kandola might have a reaction to that, and a response maybe to people who are wondering why the Yukon has implemented those measures and the NWT has not.
So I believe that those Yukon measures will go into force on May 25th, which is quite a while away from now. What we do know is we looked at our importation risk when we were looking at our self-isolation measures. We do know that our neighbor to the south is Alberta, and they do have the highest rate of active infections in Canada right now. They're also where most of our travelers come from. So that gives us a high importation risk. We know that the fully vaccinated individuals have a significantly reduced chance of becoming infected and transmitting, but we do know that people still can get infected. So with a combination of extremely high rates of active infection in the rest of Canada, especially in Alberta, and given that the vaccine is not 100% effective, the most prudent measure that we've taken to date is to have fully vaccinated individuals isolate for 7 days, do a day A test negative, and then they can safely self-monitor the second week. This is never been so important right now. Is we're dealing with a large-scale outbreak in Yellowknife, so we really can't afford to have more infected travelers transmitting at this point.
Thank you for that, Dr. Kandola. Leni with CBC North, you have a question for either Dr. Peg or Dr. Kandola?
Yeah, hi, thank you. I suspect this question is for Dr. Peg. What has the vaccine, I mean, I know it's only been a day and a half, but what has vaccine uptake been like so far in people between 12 and 17 years old? Do you have any statistics from yesterday?
I don't have the final numbers, unfortunately, from yesterday, but I do know that the vaccine appointments filled up incredibly quickly. There were 504 appointments that were booked in a 2-hour period, which probably envies some concert tickets and concert sales from years gone by. So the interest in the vaccine has been very, very high, which is incredibly encouraging to see. And again, I do just want to reassure people that we are opening up more appointments as we know about vaccine availability, and that there will be enough vaccine available for those people who do want to get that vaccine. We did plan to do 72 yesterday. It slowed down a little bit to ensure our process from where we're going to be finally in terms of numbers of appointments once the clinic is fully up and running. But we'll be able to be giving you a running total likely in the coming days. But good job, everyone, in the interest that has been shown for that vaccine.
Thank you. My follow-up question. There was a school soccer tournament last Friday and Saturday. I wonder if that was approved by public health.
So part of relaxing restrictions, part of with Emerging Wisely, we approve all sports activities, and we've had a number of sports activities come through with a request to vary, and we review the proposal and we apply the appropriate public health mitigation measures. And so that organizer for that event did go through our office and did submit a plan, and the plan was approved.
Can I ask a follow-up to that?
We'll get back to you in there's a couple of more to follow up with, Leni, but it'll get back to you on that, or you can send a follow-up to me on that as well.
Thank you.
Yep, you're welcome. Brett with CKLB, do you have a question for either Dr. Peg or Dr. Kandola?
Yes, thank you. I believe this question is for Dr. Peg. I'm wondering if you can comment on the logistical challenges of getting the Pfizer vaccine to teens in isolated communities and what is being done to overcome these challenges in the coming weeks.
One of the great things that I would like to say about our vaccination team is their forward thinking and forward planning capacity. And back when Pfizer was the only vaccine that was approved in Canada, we did start efforts to procure storage freezers and transport freezers in the event that we would need them. As the requirements for Moderna were less onerous, and that was what was determined to be the best fit for the initial rollout here in the territory, we were able to still use some of that equipment because it was adjustable to use for transport for Moderna. But we do have a plan for storage of the vaccine in those freezers that are ultra cold chain, as well as transport freezers for the ultra cold chain, and teams that are trained in the use to make sure that that vaccine stays usable and stays in good condition right up until the moment that it's being administered to residents of the Northwest Territories.
Brett, do you have a follow-up for either Dr. Kandola or Dr. Peg?
Yes, thank you. Dr. Kandola, does your office have any models or projections to predict how many cases there could be from this NJ cluster while still being contained? Thank you.
So to date, we've had 47 confirmed cases, and where we're seeing the spread is within household contacts. We have determined from the initial swabs that this is a UK variant. We do know that the UK variant of B117 is extremely contagious, has a higher attack rate than other variants. So right now, the biggest risk of spread is the household. So that's why in my early speaking notes, I just identified ways that we can minimize the exposure of household contacts to cases. When we're looking forward, it's now, we have shut down NJ in all schools since Monday, so we're on day 4 of 5. There have been a lot of exposure notifications, but to date we haven't seen any reported case resulting from that transmission. So it's going to be the matter of looking what's happening in the next couple of days, especially if we finish day 5 and 7, and if we have minimal cases that could help us understand the extent and scope and magnitude of the outbreak. What we do know was that the cases were introduced into NJ and during that week of the 26th to 30th, and we were able to shut down that school and identify them all as contacts on Sunday, May 1st, and so May 2nd. So we're going back and providing as many exposure notifications as possible. As every day goes by, we're not, and we're testing these close contacts, we're not seeing any of the secondary transmission from NJ back to the exposure notifications. We are asking everyone, though, who's symptomatic to come forward and get tested, but we haven't had any evidence that there's been community transmission. And we're monitoring each day to see if we caught it in the nick of time and just limited it to the NJ students, staff, and volunteers and their households.
Thank you, Dr. Kandola, for that response. I'll go to Mario with Radio Canada. Do you have a question for Dr. Pegg or Dr. Kandola?
Of course, I have a question, and good morning, everybody. It's for Dr. Kandola. Taking all we've talked about in this press conference into account, and the fact that we know that the situation is very much evolving, at what point will you be comfortable reopening the schools? Is it 14 days after? Well, yeah, I guess that's my question. At what point will you be comfortable reopening all schools?
The best time for me to assess the situation would probably be the next week, because then I can look to see have we captured all the cases and their household contacts, and have there been any secondary transmission. What we do know is we've done over 1,300 tests, and the percent positivity has been quite low, between 3 to 4%. So as each day goes by and as we monitor the close contacts from these exposure notifications, it will help determine if we've contained the virus. So next week will be critical. However, you also have to realize that at the same time that we're containing this virus, the households and the close contacts, we're also rolling out an ambitious 12 to 17-year-old vaccination program. And we do know it takes about 14 days after the first dose to achieve significant immunity. So we're attacking this on 2 fronts: containing as many close contacts as possible and testing close contacts and symptomatic cases, and rolling out the vaccine for middle and high school as quickly as possible. With those 2 things occurring, I am optimistic that we will be able to open the schools, but I can't give you a firm date today. I can give you a firmer date next week.
Perfect. On a separate note, well, similar note, for my follow-up, for the vaccine clinics for the 12 and to to 17 years old. Do you, in Yellowknife, do you expect that it's going to continue with like clinics at the vaccination center, or could you possibly make clinics at schools or something like this? Is that an option?
Hi there, I can answer that. So right now we're operating the clinic out of the vaccination center, and that's primarily for logistical reasons. That's where our team is operating, and that's where we are set up to provide that vaccine. There is discussion certainly for the future is how to deliver vaccine effectively and efficiently, and school-based vaccination programs have worked before in the Northwest Territories, and we have a lot of experience with that. So that's certainly a possibility going forward. But for the moment, the vaccinations will be happening at the vaccination center that we have set up. Thanks.
Thank you very much, Dr. Peg, for that response. Yeah, that brings us to the end of our media briefing. Thank everybody for attending and taking time out of your busy schedules to take part in this. Again, if you have any follow-up questions, you can email me at Darren Campbell, Darren_P_Campbell@gov.nt.ca, and we'll try to get back to you as quickly as you can. And again, thanks very much, everybody, and have a great rest of your Friday.